Good evening. This is Dr. Thomas Klein from the National Pain Council and from JATH, J-A-T-H, Educational Consortium, the research group for the National Pain Council. And we've got some kind of exciting news for you, even though it was from 2018, hasn't seemed to catch on. We have kind of an anti-opioid atmosphere, and anything that's pro-opioid pain treatment kind of gets pushed aside. But we have this disease called fibromyalgia. 70% are women, and so because they're women, this has been passed off as a disease of women. Now, male doctors see diseases of women as originating from some mysterious place within the female's psyche, and it's been passed off as a disease that's probably psychological. What it is, fibromyalgia, is intense pain here and there all over, characteristic of chronic inflammatory diseases that we're going to be presenting soon in our paper on rare painful diseases. So the Massachusetts General Hospital and the Karolinska Institute in Sweden decided to do PET scans. Now, a PET, P-E-T, scan is kind of like a special MRI that shows you activity. Regular MRIs just show what's there, but this can show activity. And what the activity that shows up on the PET scan is anywhere there's inflammation. It's used in cancer to track down where metastatic lesions are. It's there to track down lesions like a chronic infection in the bone. But what they did is they took a bunch of patients, women, mostly women, and they did PET scans in both countries. And lo and behold, maybe we can look at this little picture. What do you see those little areas there? Those are areas of inflammation on the PET scan in the brain. Well, your brain doesn't normally have a lot of inflammation in it, so lo and behold, it's part of a total body inflammation, which we now are assigning as the cause for most chronic pain patients. We're going to develop specific diagnoses for them, so they're no longer called CPPs. So fibromyalgia is now, we're making a new name for it, we're calling it Central Pain Syndrome, because your brain is in charge of everything. So if your brain becomes inflamed along with the rest of your body, you got a serious problem. And guess what the best drug is? The best drug would be a painkiller and an anti-inflammatory. Inflammation of the brain, anti-inflammatory, pain for the pain. Guess what opiates are? Opiates are both painkillers and anti-inflammatory. So we are developing a paper on this. If anybody wants a copy of it, they can email us at nationalpaincouncil@gmail.com. So then they went one step, that was 2018. Around the same time, a different group in Korea looked at patients with CRPS and PET scan. Now, CRPS is complex regional pain syndrome, a fairly common and disastrous illness of total body pain, difficulty maintaining your blood pressure, funny heart rates, rashes that feel like bee stings, sudden release of your bladder, just on and on. Imagine anything that can takes place with CRPS. So this study is called positron emission tomography, PET, in patients with complex regional pain syndrome. And lo and behold, most of them showed the same thing that we just saw, of inflammation in the brain. So at National Pain Council, we're looking at as many of the rare painful diseases as we can to see if they'll show up on PET scan. So I called a couple of hospitals and asked them about PET scans, and because they didn't know anything about it, I got put off. There's no fixed price for the PET scans, but we need to look into that because this is the way to diagnose these god-awful diseases. You do a PET scan, there's inflammation in the brain, and then you treat with both painkillers and anti-inflammatory agents. So that is the story on fibromyalgia and CRPS in terms of brain inflammation. We'll be talking about this some more. This is just scratching the surface. So good night, and I will see you next time.